Imagine for a moment that you are walking through the bustling streets of Rome during the height of the empire. The air is thick with the smell of roasting meat, expensive perfumes, and the ever-present stench of the open sewers. Suddenly, a sharp, stabbing pain shoots through your leg. You've developed a deep infection or perhaps a fracture that refuses to heal. Today, you would head to a sterile hospital, receive a dose of local anesthesia, and be treated by a doctor with a sanitized degree. But in the 2nd century AD, your options were far more limited and infinitely more terrifying. In ancient Rome, the line between a life-saving cure and a slow, agonizing death was razor-thin, and often the cure was worse than the disease. If you lived in ancient Rome, your first instinct upon falling ill wouldn't be to find a doctor, it would be to find a god. To the Romans, illness was often seen as a divine punishment or a sign of spiritual imbalance. You might visit the temple of Asclepius, the god of medicine, hoping for a healing dream while you slept on the floor of a sacred chamber. But when the gods remained silent and the pain became unbearable, you had to face the reality of Roman medical practice. This was a world where medicine was a brutal mix of legitimate anatomical genius, absolute superstition, and primitive surgical techniques that would make a modern horror movie look tame. There were no medical licenses, no formal regulations, and no germ theory. Anyone could call themselves a medicus or doctor, and the only thing standing between you and a rusty iron scalpel was the depth of your coin purse. The Roman approach to health was a fascinating contradiction. On one hand, they were masters of public health, building massive aqueducts to bring fresh water and complex sewer systems like the Cloaca Maxima to carry away waste. They understood that bad air and stagnant water caused sickness. Yet on the other hand, the actual practice of treating an individual patient was a chaotic frontier of experimentation. If you were a soldier in the legions, you might have access to the valetudinarium, a military hospital that was surprisingly advanced for its time. But if you were a common civilian in the city, your medical journey was about to become a visceral lesson in pain endurance. Before we dive into the specific cures involving goat dung, human blood, and vinegar, we have to understand the tools of the trade, instruments designed not just to heal, but to cut, saw, and drill through the human body while the patient was wide awake. To truly understand the terror of Roman medicine, we first have to look at the men holding the knives. In Rome, the medical profession was a strange social paradox. Most Medici were actually Greek, often slaves or freedmen, because the Roman elite initially viewed the practice of medicine as a manual trade beneath their dignity. While some were brilliant scholars who followed the teachings of Hippocrates or Galen, many were simply charlatans looking to make a quick denarius. Without a formal licensing board, a failed gladiator or a bankrupt merchant could hang a sign outside his shop and claim to be a surgeon. This lack of oversight meant that every trip to the doctor was a high-stakes gamble with your life. The famous Roman writer Pliny the Elder once bitterly remarked that only a doctor can kill a man with impunity. If you were lucky enough to find a skilled practitioner, you would eventually enter his surgery room, which was often a small, dimly lit corner of a shop or a house. There you would see the tools of the trade laid out, a collection of bronze and iron instruments that looked more like a torturer's kit than a medical set. Archaeologists have recovered these kits from the ruins of Pompeii, finding scalpels of various shapes, sharp hooks for retracting skin, and specialized bone drills called terebrae. Perhaps the most frightening of all was the bone saw, used for the frequent amputations required in a world of constant warfare and infection. These saws were made of high-carbon steel, but they were never sterilized. A doctor might move from a patient with a gangrenous leg to a woman in labor without so much as wiping his blade, unknowingly spreading lethal bacteria from one person to the next. But the true horror wasn't just the tools, it was the sensation. The Romans did not have modern general anesthesia. While they were aware of the numbing effects of opium poppies, mandrake root, and henbane, these substances were incredibly dangerous. A dose slightly too small did nothing for the pain, while a dose slightly too large could stop the patient's heart forever. Consequently, many surgeons preferred to operate on a fully conscious patient. The screams from a surgery room were a common sound in Roman neighborhoods. To be a successful surgeon, one had to be cold and indifferent to the agony of the patient. Aulus Cornelius Celsus, one of the most prominent medical writers of the era, stated that a surgeon should be so far void of pity that he remains unmoved by the cries of the person he is cutting, focusing only on the precision of his hand. Imagine the mental fortitude required to sit still while a bronze drill was slowly spiraled into your skull to relieve pressure, a process known as trepanation, with nothing but a leather strap to bite on. While the physical reality of surgery was a nightmare, the logic behind Roman internal medicine was perhaps even more bizarre. The Romans followed the theory of the four humours, a concept inherited from the Greeks that would dominate medical thinking for nearly 2,000 years. They believed the human body was filled with four essential fluids: blood, phlegm, yellow bile, and black bile. To be healthy, these four fluids had to be in perfect balance. If you had a fever, your blood was too hot. If you were depressed, you had too much black bile. The solution: rebalance the fluids through any means necessary, usually involving vomiting, purging the bowels, or the most infamous practice of all, bloodletting. Bloodletting was the universal answer for almost every ailment. If a patient was weak from an infection, a Roman doctor might decide the best course of action was to slice open a vein and drain even more of their life force. They believed that by removing excess blood, they were removing the toxins causing the disease. This practice often left patients severely dehydrated and dangerously weak, frequently accelerating the death they were trying to prevent. But in the Roman mind, if the patient died after bloodletting, it wasn't the treatment that failed. It was simply that the humours were too far out of alignment to be saved. When they weren't draining your blood, Roman Medici were prescribing medicines from a pharmacopoeia that reads like a list of ingredients for a witch's cauldron. They relied heavily on the doctrine of signatures, the idea that plants that looked like a body part could cure that part. But it went much further into the macabre. For instance, if you suffered from epilepsy, a common Roman cure was to drink the warm blood of a freshly killed gladiator. It was believed that the gladiator's strength and vitality would be transferred to the patient through their blood. Crowds would sometimes rush onto the arena floor after a fight, desperate to catch a few drops of the miraculous liquid. For external wounds, the remedies were equally stomach-churning. A popular poultice for skin infections involved mixing honey with vinegar, which actually had some antiseptic properties, but then adding dried goat dung or pig manure. The Romans believed that the heat in animal waste could draw out the infection. Even the most respected figures of the time had their own medical obsessions. Cato the Elder, a famous Roman statesman, was convinced that cabbage was a miracle drug. He wrote extensively that cabbage could cure everything from dislocations to internal tumors, and he even suggested that his family bathe in the urine of someone who had recently eaten cabbage to maintain their health. It was a world where science was struggling to be born, trapped under a mountain of superstition and filth. Among the most specialized and terrifying procedures in the Roman world were those involving the eyes and the mouth. Because Roman life was lived in dusty, crowded conditions with no concept of hygiene, eye infections like conjunctivitis and cataracts were rampant. If you began to lose your sight due to a cataract, a Roman oculist might suggest a procedure known as couching. In this horrific surgery, the doctor would take a sharp, thick needle and plunge it directly into the patient's eye. The goal was to physically push the clouded lens down into the bottom of the vitreous cavity, clearing the line of sight. There was no numbing of the eye, only a steady hand and a patient who had to remain perfectly still while a needle moved through their eyeball. If the needle was dirty, which it almost certainly was, a massive infection would follow, leading to permanent blindness or a slow death from sepsis. Yet remarkably, some of these couching needles found in archaeological sites are so finely crafted that they show the Romans were achieving a level of microsurgery that wouldn't be surpassed for over a millennium. They were capable of incredible precision, but they were doing it in a world of filth. Dentistry was equally brutal. The Romans actually cared quite a bit about their teeth, using toothpaste made of crushed bone, eggshells, and occasionally human urine, which was prized for its ammonia content as a whitening agent. However, when a tooth decayed beyond repair, there were no fillings. The only solution was extraction. A Roman dentist would use a tool called a tenaculum to grip the tooth, but before pulling, they would often pack the cavity with lint or lead so the tooth wouldn't crumble under the pressure of the pliers. If the tooth was stuck, they might cut the gums away first. The risk of a jaw infection or a shattered bone was immense, and without antibiotics, a simple toothache could easily become a death sentence. Perhaps the most sophisticated yet gruesome area of Roman medicine was its military surgery. The Medici, who traveled with the legions, were arguably the best in the world. They faced a constant stream of arrow wounds, sword slashes, and crushed limbs. These military doctors developed the first use of hemostatic tourniquets and arterial clamps to stop bleeding. They were the masters of battlefield triage, knowing exactly when a limb had to be sawn off to save the soldier's life. However, even these elite doctors couldn't stop the silent killer, gangrene. Without the knowledge of microbes, a soldier might survive a heroic surgery only to die a week later in a feverish haze because the doctor's silk sutures were contaminated. To understand the peak of Roman medical knowledge, we have to talk about Galen of Pergamon. Galen was the personal physician to several emperors, including Marcus Aurelius, and he became the most influential medical figure in history. Because Roman law strictly forbade the dissection of human bodies, viewing it as a religious desecration, Galen performed his anatomical research on pigs and Barbary apes. He assumed that since these animals had 4 limbs and similar internal organs, their biology must be identical to ours. This led to centuries of medical errors, such as the belief that the human heart was divided by a porous wall, or that the liver was the center of the circulatory system. Despite these flaws, Galen was a pioneer. He was one of the first to prove that arteries carried blood, not air, and he successfully performed complex brain and eye surgeries that seem impossible for the time. However, his ego was as massive as his influence. He claimed his system was perfect, and because of his status, his teachings became absolute dogma. For the next 2500 years, questioning Galen was seen as medical heresy. This meant that even as the Roman Empire fell, the terrifying reality of its medicine, the bloodletting, the humours, and the dung-based poultices lived on, stifling new discoveries well into the Renaissance. Looking back, the reality of Roman medicine is a story of incredible human endurance. It was a time when the hospital was often just a room where you went to die, and the pharmacy was a collection of superstitions. Yet, we cannot ignore their contributions. The Romans gave us the foundations of surgical tools we still recognize today, the concept of specialized military hospitals, and the understanding that clean water is the first line of defense against disease. They were brilliant engineers who were simply missing the one thing that would have changed everything: the microscope. So, the next time you feel a slight fever or a nagging toothache, take a moment to be grateful for modern science. In the world of the Caesars, You wouldn't be reaching for an aspirin. You'd be bracing yourself for a bronze needle, a handful of goat dung, and a prayer to a god who might not be listening. The Roman Empire was a marvel of civilization, but when it came to your health, it was a brutal, bloody, and terrifying place to exist. But then tell me in the comments, which of these Roman cures shocked you the most? Would you have risked the surgery or trusted the gods? And don't forget, if you enjoyed this journey into the darker side of history, leave a like and subscribe to our channel. I'll leave another video suggestion here on the side for you to watch next. See you in the next episode.